instructor that's working here.
Okay.
What's your name?
Travis.
Nice to meet you, Travis. Today, I'm going to be doing what we call a musculoskeletal exam to kind of just see how your muscles and joints are working. And then I'll also be doing a neurological exam on you as well, okay?
Okay.
All right, so I'll be testing some cranial nerves and some muscle strength and things of that nature. And I'll be using different devices to help me along with that process, okay?
Okay.
This will involve some touching or what have you. Is that okay with you?
Mm-hmm.
Wonderful.
Okay.
All right, so let's start off with your musculoskeletal exam. And I'm going to start with your face. Just looking at your face, his face is symmetrical. There's no asymmetry of the face noted at all. I'm going to palpate the muscles of mastication, temporal, pterygoid, and masseter muscles. Okay, I want you to clench your jaw as I do those. Okay. Okay. Wonderful. There's symmetry in the movement as he clenches his jaw. I'm going to just put my fingers here. I want you to open and close your mouth. Okay, his TMJ movements are symmetrical on both sides bilaterally. I'm going to look at your shoulder, okay? And I'm going to just look at the shoulder. I don't see any swelling. There are no deformities, no effusions noted to the shoulder. I don't note any muscle atrophy or fasciculations to the shoulder on visual inspection. I'm going to also just palpate the shoulder. Any tenderness or pain noted here?
No.
Okay, good. Okay, and I'm just going to put my hand over it. Okay, this shoulder is warm. It's not hot. And again, there was no tenderness or pain noted on the exam, and no deformity noted to this shoulder. I'm going to do the same on this other shoulder as well, okay?
Okay.
Again, this shoulder, I don't see any deformities, any nodules, any areas, like I said, that would suggest an effusion. I'm going to palpate. Do you feel any tenderness or soreness anywhere?
No.
Okay. No tenderness or on palpation. I'm going to just put my hand over this joint. It is warm. It's not hot to touch on examination. Okay, wonderful. Again, no deformities, nodules, or noted, or fasciculations noted to that shoulder. I'm going to also put you through some range of motion as it relates to your shoulder. So I'm going to ask you to do what we call abduction. And abduction is where I want you to take your hand out to the side like this and then up. Okay? And then bring it back down. Okay? Let's do it on the other side. Out to the side and then up. Okay? Abduction. Let's do adduction where we're going to bring this arm in across the body. Good. And let's do it on the other side. Wonderful. Good job. We're going to do internal rotation where we take both hands and try to touch the back here. Mm-hmm. Okay. And then external rotation, we're going to take our hands out like this and up like that. Okay. Wonderful. Good job. Okay. All right. So I'm going to now look at your elbow. Again, the elbow, I don't see any deformities. I don't see any nodules. I don't see any effusions or swelling noted to this elbow. I'm going to press around on the elbow. Any tenderness or discomfort?
No.
Okay. Again, no tenderness, no discomfort, no swelling, no nodules, no deformity noted on examination of the elbow. I'm going to do the same to the other. All right. No deformity, nodules, or effusions noted to the elbow. Any tenderness or discomfort noted to this elbow?
Not at all.
Okay. There's no tenderness to the elbow, no discomfort upon palpation of this elbow. I'm going to kind of put my hand over this elbow. This area is not hot. It's warm to touch. And I didn't do it on this side, so I'll make sure I do it on this side. And again, warm to touch. No, it's not a hot joint or anything like that. So what we're going to do is flexion and extension of the elbow. So this would be flexion. Good. Extension. Good. And we're going to hold your palms out like this. Supination. And turn your palms down like this. Pronation. Wonderful. Okay. Good job. We're going to now look at your wrist and your hands. And on this inspection, while the patient was moving his hands, I noticed symmetry of movement. There was no asymmetrical movement of the wrist or the hands. I don't know any deformities to either wrist or hand. No nodules. I'm going to press around on these joints. Let me know if you feel any tenderness or pain anywhere. Any tenderness or discomfort?
No.
Good. Okay, no nodules or swelling noted to the wrist or the hands. I'm going to get you to bind your hands up like this, and I want you to pull them up this way. Good. That's flexion. I'm sorry, that's extension. This is flexion. Good. And I want you to take your hands here, and I want you to move them inward. Radial deviation. Ulnar deviation. Awesome. Cool beans. Alright, so now we're going to test your grip strength. And pretty much what I want you to do is just grab my 2 fingers. Keep me from pulling them out of your hands, okay? Okay, wonderful. His grip strength is 5 out of 5. Awesome. We're going to also look at flexion, extension, and abduction and adduction of your fingers and your fingers. So flexion would be this. Extension would be this. Good. Adduction would be this. Abduction would be this. This. And then adduction would be this. Wonderful. Good job. Okay. Alright, so let's stand up for me, and we're going to look at your spine. Alright, Mr. Travis has an erect posture, and I'm going to look at his spinal column. I don't see any kyphosis, lordosis, or scoliosis of the spine. I'm going to, at this point, as it relates to his spine, I'm going to watch him walk to the door and walk back to the table for me, Mr. Travis. He has erect posture. His gait is steady and it is smooth. Okay, you can stand right there for me. Good deal. Let me get you to, I'm going to palpate your spine. Let me know if you feel any pain or tenderness anywhere. No pain or tenderness?
No.
Good. Good. There's no swelling. There's no nodules. There's no deformities of the spine. Let me get you to just bend over like this. This would be flexion. Go back like this. Extension. Alright, just stand straight up. I want you to do this on both sides. Okay, this is rotation. Good. And then we're going to do this. Bend to the side. Lateral bending. Okay. Wonderful. Have a seat on the table for me. Okay. When Mr. Travis walked, again, his gait was steady. It was smooth. There was no weakness or limping noted to his gait. On palpation, I'm going to look at your hip, Mr. Travis, if you don't mind. Just lie back for me. Alright, I'm just going to pretend that we're looking at your hip. Alright, I don't see any swelling. I don't see any nodules. I don't see any effusions. I'm going to palpate this hip. Any pain, soreness, or tenderness anywhere?
No.
Okay. Again, no swelling, no deformity noted to the hip. I'm going to do the same on the other hip. And I can do this with Mr. Travis standing or lying down. Again, no deformity, no nodules, any discomfort or pain as I'm pressing on this hip.
No.
Good. Both hips are warm. There is no hot temperature to either area. Okay. Let's do some range of motion of your hip, okay?
Okay.
Alright. So what we're going to do first is flexion. And I'm going to put my hand here. And I want you to bring this leg up to your, I'll tell you what, put this one down. Bring this leg up to your chest. All the way up. Good. Alright. And this would be extension. Good. Alright, let's do it on the other side. Alright, bring this knee up. All the way up. There we go. Alright, that's flexion. And I'm going to pull this leg off the table. That's extension. Good deal. Alright. Wonderful. We're going to do internal and external rotation. Sit up for me. I'm sorry. at your leg back down. I need to do abduction and adduction. So I want you to pull your legs out against my hand. Okay, good. That is adduction, or I tell you what, I'll do it like this. This is abduction. This is adduction. Okay, let me do it on the other side. Just relax for me. Okay, this is abduction, and this is adduction. Okay, all right. Now, did that properly. All right, now you can sit up. Good. And we're now going to look at your knee. The knee doesn't have any swelling that I can note. There's no deformity. There's no signs of effusions to either knee. I'm going to palpate your knees. Is there any pain or soreness anywhere?
No.
Good. Okay. Wonderful. All right. Again, no swelling, no effusions, no deformities, no nodules. I'm going to put my hand over your knee, lift your leg up. Okay. Down. Up, down. No crepitus felt on palpation. The joint is warm on both sides bilaterally. We're going to do some range of motion on the knee. I want you to, first we're going to start off with internal and external rotation. So turn your feet inward. Internal rotation, external rotation. Good. Stand up for me. We're going to do flexion and extension. So flexion, I want you to squat. Okay, that's flexion, that's extension. Have a seat. Cool. All right. So now we're going to look at your ankle and your feet. So if you don't mind, you can take your shoes and your socks out. Okay, and I'm just going to pull this out. Okay, so to the ankle and the feet, I see no edema. There's no edema of any kind. There's no nodular area seen. There's no deformities noted. I'm going to palpate on the ankle. I'm going to also palpate on the Achilles tendon. Okay, any pain or discomfort with me? Okay, good. I'm going to also palpate the toes. Any pain or discomfort?
No.
Okay, wonderful. Again, these joints are not hot. They are warm to touch on examination. We're going to do some ankle range of motion. I want you to point your toes back this way. Good. That's called dorsiflexion. And push them down like you're pressing on gas. That's plantar flexion. Wonderful. Good job.
Okay.
So now we're going to move on to your neurological examination. And I'm going to give you something to smell. Okay. And we're going to test cranial nerve number 1, okay, which is the olfactory cranial nerve. It tests the sense of smell. First, I want you to just take your finger and include one nostril. Breathe in and out. Okay, let's do the other nostril. Good. Both nostrils are patent. So I have something in my cup, and I want you to close your eyes for me, and I want you to occlude one nostril and tell me what you smell. Okay, what did you smell?
I smell sugar.
Like what kind?
Cinnamon.
Yes, cinnamon. That's what it is. Okay, let's do the other side. Alright, what did you smell?
The same.
Cinnamon. Okay, wonderful. Alright, now we're going to do a test called he was able to smell the cinnamon, so cranial nerve 1 is intact. I'm going to do what we call a Rosenbaum test, and I do not. Here's the chart here. Okay, yeah, go ahead and put your socks on, because it is kind of cool in here. Okay, alright, so with this test, I want you to cover one eye, and then I want you to read the lowest line that you can see, okay? And you can hold this. Just hold it where you would typically hold a book at reading level for you, okay? And just read the letter, the numbers or letters. You don't have to read that part or that part, okay?
6, 8, 3, 2, 7, 9.
All right, that's 20, 25 in the right eye. Let's do the other eye. Get over here.
6, 8, 3, 2, 7, 9.
Okay, that's 20, 25. Mr. Travis has 20/25 vision in both eyes. Cranial nerve 2 is intact. Now we're going to do assess cranial nerve 3. We're going to look at his pupils. All right. His pupil size currently, just open your eyes real big for me, are at about a 3. Yeah, about a 3. I'm going to cut my light off. All right. I want you to look straight at my nose, okay? Okay. All right. His pupils are round, equally reactive to light. His pupils constricted from a 3 to a 2. Now I'm going to do a test called the H test. Well, we'll assess your extraocular movements. I want you to just follow my finger, okay? Just look straight at my fingers and follow them, okay? All right. Okay, wonderful. His extraocular movements didn't show any signs of nystagmus. Did you note any blurred vision while you were doing that?
No.
There was no double vision or blurred vision on exam. So with those tests that I just performed, I'm going to do one more. Look straight at my nose and follow my finger in. His eyes did converge to the midline. So cranial nerve 3, 4, and 6 are intact. Now I'm going to look at cranial nerve 5. I'm going to palpate your masseter muscles and note the strength of the contraction. So I want you to just clench your jaws. Wonderful. Good. All right. And then we're going to do another test to determine sensations. So what I'm going to do is you're going to let me know if what you're feeling is dull or sharp, okay? And you're going to close your eyes for me on this one, okay? When you feel it, let me know which one it is, dull or sharp.
Dull.
Okay.
Dull.
Okay.
Dull. Sort of. Sharp.
Okay.
Sharp.
Okay. All right. You can go ahead and open your eyes. We're going to do another test on you, Mr. Travis, for what we call light touch. And when you feel something touch your face, just say, I feel it, okay?
Okay.
Go ahead and this is what it will feel like. Okay. All right. Just close your eyes and tell me when you feel it.
Feel it. I feel it. Feel it.
Good.
Feel it.
All right.
Feel it.
Good deal. All right. We tested for dull and light touch and sharp touch to the face. And we also palpate those masseter muscles. I'm going to also palpate the temporal muscle. Clench your jaws. All right. Wonderful. Cranial nerve 5 is intact. Now we're going to assess your cranial nerve 7, your facial nerve. And his face at rest is symmetrical. I don't see any weakness to either side of his face. I'm going to also say, as it relates to his face, that there's no involuntary movements. Let me see your teeth. Good. All right. I want you to close your eyes and keep me from opening them, okay? Close them shut. And I want you to keep me from opening. Okay. Good. All right. Also, I want you to wrinkle your forehead, like, there you go, and puff out your cheeks. Wonderful. Cranial nerve 7 is intact. Now I'm going to do a test called the whisper test. What I'm going to do is whisper a series of numbers to you or letters. I want you to repeat them back to me once I've said them to you, okay? All right. Wonderful. Let's do it on the other side. Right here.
Sorry. My hair's probably in the way.
There, that's okay.
1, 2, 3.
Wonderful. Okay. Mr. Travis passed that whisper test, so therefore cranial nerve 3 is intact. Now we're going to do what assess cranial nerve 9, 10, and 12. So on this exam, I've already noted his vocal quality. His vocal quality is clear. His speech is clear. There is no nasal quality or hoarseness noted. When he speaks articulately. His words are fluent. Again, he speaks clearly. I'm going to look at your throat, Mr. Travis. If that's okay with you.
Mm-hmm.
Okay. Alright. So what I'm going to do is just ask you to say "ah" for me. Look straight at me. Hold your head back a little bit. Okay. Say "ah." Okay. The uvula rise and fall upon him saying "ah." It is in the midline. Stick your tongue out for me. Just like this. Okay. Move it from side to side. Okay. His tongue movements are symmetrical. The tongue falls in the midline when it is moved outside the mouth. There's no deviation. At this time, I would assess the gag reflex on him, but I'm not going to do that to Mr. Travis. We're going to assume that gag reflex is normal. Therefore, cranial nerves 9, 10, and 12 are intact. Alrighty, so now we're going to move on, and we're going to assess his spinal nerves. So I want you to shrug your shoulders against my hands. Good. I want you to press your face against my hand. Wonderful. Let's do it to the other side. Wonderful. All right, cranial nerve 11 is intact. His body position is erect, it's upright. There are no, again, any involuntary movements, which I'll speak to his motor system. We're going to test some upper strength. So I want you to take your arms like this, and I want you to keep me from pulling them down, okay? Good. I want you to take the same hand and push against me. Okay. His flexion and extension of the upper body strength is 5 out of 5. I want you to take your fist, pull them up like that. Keep me from pulling them down. Good. And take them like this and keep me from pulling them up. Okay. His wrist strength is 5 out of 5. Let's do the grip strength again. And I want you to keep me from pulling my fingers out of your hand. His grip strength bilaterally is 5 out of 5. Strong grip strength. Now we want to test what we call fingers abduction and adduction. I want you to take your fingers like this. Keep me from pushing them together, okay? Keep them like this. Now keep me from, good. All right, again. Good. His finger strength are graded 5 out of 5. We've already looked at his coordination, his gait. It was smooth again. It was steady. His stance and swing again was steady and smooth. There was no limping. There was no any dragging of any limbs. His gait was smooth. We're going to do a test called the Rumberg test. I'm going to have you stand over here for me. And what I want you to do is just stand with your hands at your side. And I'm just going to have you stand like this for a couple seconds. Alright. So now I want you to close your eyes and I want you to stand that way. Stand here for me. With your eyes closed. Eyes closed. No. Close your eyes. Yeah. Just close your eyes and stand here for me. And we're going to have you stand here for about 30 seconds. Okay, wonderful. You can have a seat.
Okay.
His Romberg test was negative. There was no swaying. His feet did not come apart. He is negative on the Romberg's test. Now we're going to do some lower muscle extremity strength. So what I want to do is have you lie back for me. Okay. And I'm going to press my hand against your leg and ask you to raise your leg up against my hand. Good. Hold your leg straight out and raise it up. Straight out. Wonderful. All right. And I'm going to lift your leg up. And I want you to press down on my hand. Okay?
Okay.
Press down. Good. That's 5. We're going to do it on the other side. We're going to do the same thing. All right. Try to raise your leg up against my hand. Good. And I want you to push down on my hand. Wonderful. 5. 5 out of 5 on his hip strength. We're going to do a test called with your hips abduction and adduction. So for adduction, I want you to push your legs out against my hands. Okay, abduction. And I want you to push your legs inward towards my hand. Adduction. And he is 5 out of 5 on both. All right, let's do flexion and extension of the knee. And what I want you to do, I'm going to bend this leg. Okay, I want you to straighten your leg. Okay, now relax. Look, bend it for me. I'm going to push against your leg, and I'm going to try to keep you from straightening it, but I want you to straighten it.
Okay.
Push, try to straighten your leg. Okay, wonderful. Now I'm going to try to straighten your leg for you, okay?
Okay.
Hold on, bend your knee. Okay. Now keep me from straightening.
Okay.
Okay. Good. All right. Let's do it on the other side. All right. And let's bend this leg. Okay. And I want you to try to straighten your leg, okay?
Now.
And don't allow me to straighten I'm going to try to keep you from doing it, but don't allow me to do it. Okay. Okay, good. And bend your leg. Now I'm going to try to straighten your leg. Keep me from straightening it, okay? Good. All right. Flexion and extension of the knee are both 5 out of 5. You can go ahead and sit up for me. We're going to test your reflexes, okay? And we're going to start off with your, let's start off with your bicep reflex. Okay. Thank you. Okay. I did a list of the restraints. That's biceps. There's this one. Relax for me. Good. Okay. Didn't I get it? Let's do this one. Okay, relax for me. Okay, good. That's triceps. We're going to do brachioradialis. Okay, I'm going to try on the side. Okay, we're going to do the patellar reflex or the knee reflex. Okay, and we're going to do I'm going to need you to take your shoes and your socks off again. I'm sorry. So our reflexes to this point are they are elicited and they are 2+. Now we're going to do the plantar response and the ankle reflex. Okay. Ankle reflex are 2+ bilaterally. Lie back for me. We're going to do the plantar response. Okay. 2+ bilaterally. Alright, go ahead and sit up. Alright, so now we're going to do a test, Mr. Travis, to determine your ability to sense pain and light touch. It's kind of like the test we did a minute ago, but we're going to be doing it to your upper body and your legs, okay?
Okay.
All right.
Keep my socks off?
I tell you what. Yeah, keep your socks off.
Okay.
Glad you asked that. Alrighty. So, again, this is sharp and this is dull. Okay? Alright, close your eyes for me.
Sharp. 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 Dull. 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 Sharp. Dull. 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 Dull.
Okay. Alright, you can open your eyes. And he was able to determine which was light and which was dull and which was sharp on examination. We're going to do a test for light touch. This is what it will feel like, okay? When you feel it, just say, I feel it, okay? Close your eyes for me.
I feel it. Feel it. Feel it. Feel it. Feel it. Feel it.
Okay.
Feel it.
Wonderful. He was able to determine whether or not he was able to feel light sensations. Now, what I'm going to do, I'm going to use my tuning fork and you will feel a vibration. I want you to let me know when you feel it and when it stops, okay?
Okay.
I want you to close your eyes for me, and I'm going to do it on your hands as well as your toes, okay?
I feel it. Stop. I feel it. Stop.
Good.
Feel it. Stop. Feel it. Stop.
Good. All right. He was able to determine when he was feeling the vibration as well as the stopping of the vibration. And we're going to do another test called a position sense test. And I'm going to just move your fingers or your toes in a couple of directions. This will be up. This will be down. Just hold these fingers however you want to hold it. But this will be up and this will be down. Okay? Alright. And I'll just do it on your fingers and your toes. Okay? Close your eyes. Alright. Okay.
Up. Down.
Good.
Up. Down.
Good.
Up. Down.
Okay.
Up. Down.
Okay. Wonderful. Alright, Mr. Travis, you've been an awesome patient. That concludes our exam.
Okay.
And you have an awesome day, okay?
You too.
Alright.
Thank you.
Thanks, Lincoln. We're done.
Okay, that was the last video, right?
That was it. Thank you so much. You were
No
awesome.
problem. The smell.